Hey guys, welcome back to my channel. Today's video is going to be on new nurse anxiety. If you guys are interested, let's get into the nitty-gritty. Okay, so I was a new grad not too long ago, about 3 years ago to date. I was finishing up my last semester, taking all my exit exams, and in turn preparing for the NCLEX. And also, I just felt like I had this overwhelming anxiety when I was finishing nursing school because, granted, all the hardest tests are at the end, but it was like I sat back and took a second to realize I'm not cut out for this. I'm not ready. I don't think I can handle myself with all these patients by myself. It was just like a stress that I put on myself, but it was like overwhelming, and I felt like maybe I wasn't prepared for what I had already signed up for and completed, if you will. But we all feel like that, and I just want to dispel that and get through it and help you to get through it as well. So first things first, don't, in your mind, don't think I'm not cut out for this, or this isn't for me, or I'm not a people person, so I picked this for the wrong reasons. No, think positive thoughts and try to get yourself to believe you'll be fine, and truthfully you will. It wasn't until I first started my orientation, when I got my first job, that I felt like this is a piece of cake. I don't know why I was so stressed, but we all feel like that. How am I going to be able to take care of all these patients? And it's almost like you're on your own. It's not like someone's going to be telling you what to do throughout your shift, for the 12 hours or however long your hours are. So it's it's almost like you're your own boss, but not really, because there's always someone right there. But I feel like once you get a hang of how to be on your own, or like a leader, if you will, if you're used to being someone who just is content being taught or following, once you transition from that into someone who leads, it'll be a big change. You'll be able to have your own voice, and I feel like that's where I lacked in the beginning, and I was so scared, especially when I had to call a doctor or just give report to an oncoming nurse. It was so stressful for me because I was very timid and maybe not confident in my position as a new grad, or they could tell I'm a new grad, and that's where if you tell yourself I have worth and I'm worthy, you'll never feel like that. But some people do have that issue where they're very timid about their role, especially as new grads. But let that go. Completely let that go. You will be fine. I'm sure your preceptors will be fine. Sometimes if they aren't, you can always ask for a new preceptor, and that is okay. That happens. If there's some times where someone's personality just doesn't jive, just let your clinical educator know, and they'll make it, the accommodations for your learning experience. Because if you're not really getting much out of your preceptor, then it's really not worth it. And in the end, it's not beneficial for the unit. So just speak up if it's not something you want, however they're talking to you, or if they're talking down on you or whatever, just speak up and let them know, hey, not that person. Let the clinical educator know, hey, she's great, or he's great, but I don't feel like I'm getting the most experience out of him or her, and if I could maybe get a second preceptor, and they wouldn't have a problem with it. Just let them know. It is what it is. Some people just aren't cut out to be teachers, and that's okay. People sometimes just do the preceptoring so they can, get a boost in their points, or for raises or whatever. Sometimes it's just not for the right reasons. Some people just, like I said, aren't made to be teachers, and that's okay. Even though we're nurses, and nurses are, it's one of our roles, but whatever, I'm rambling on. So my biggest concern when I was first finishing nursing school was that I was too fearful that I wouldn't be cut out for it, or I wasn't ready for it. Things like that. First of all, I got my job before I even finished taking the NCLEX, and that was another anxiety that I had. So it was like, the job was like, you got it, you're in, pending your exam. And I was like, okay, it's no pressure. Tons of pressure. It was a ton of pressure. So that's that with the, feeling like you're not cut out for the job, number one. I did a poll in my unit on with the new people that we have there, and asked them what they feel like was their biggest issue in terms of transitioning from being a new grad to a new nurse. And they told me a lot of times they had a lot of issues with giving report or getting report. And every unit is different how it is on like how you give report on your patients. So I can't say for certain if, what's going to be said in report, but the main issue is that you need to be sure that you make a clear, concise description on your patient and how your shift went. You can't just tell them this is the background, like this patient had surgery. You have to let them know this patient was experiencing a lot of pain throughout the day. That way the new nurse that's coming on, not a new nurse, like the nurse that's coming on, knows how the patient had their day go. Like if they walk in and say, how was your day? And they're like, oh, it was horrible. The nurse didn't give me any of my pain medication. You have to at least get a little background on how the day went or the night went. Aside from the background on the patient. Try to be sure you give relevant information as far as what needs to be said about the patient. You don't want to explain things that aren't necessarily part of report. Like if a patient was not so nice to you, or if a patient's family member wasn't so nice to you, that doesn't necessarily need to be said in report. You never know who could be listening in the halls, especially you're supposed to be doing bedside report. So you want to make sure that it's the most, unbiased as you can, because if you're in the hall and there's a family member of a patient, you don't know that they're a family member of the patient, and you're like, oh my god, this bitch was horrible with me. She was such a rude person. Like, I don't know how people could actually come and visit her because she is awful, and things like that. That's something you don't need to say. Just make sure that the new nurse knows the situation going on with the patient, why they're here, their diagnosis, things like that, and then go through the systems. If there's something pertinent that needs to be said, if there's an incision that the patient has, how the incision is covered, things like that. Important information about the patient, okay? Another thing you can mention too is like if a patient likes something a certain way, like, I don't know. If a patient says something to you like, oh, I like my linens placed like this, or however, if it's a patient that's there for a long time or whatever, they have a certain way of doing things, make sure you hand it off in a way that the patient can get a continuity of care. That's what I'm trying to say. Pertinent information. But I remember when I was first giving report, my preceptor was like, go ahead, you say what it is. I was so stressed out. Another thing that I did do, because I didn't want to look like that nurse that didn't know anything. So like if the nurse was like, oh, when was this patient hospitalized or something, I wouldn't be like, I don't know, I didn't get that in report. I hate it when people say I didn't get that in report. That's not on the nurse necessarily that needs to tell you that. That's someone that needs to investigate. You need to dig deeper. Like if you have the patient's chart, because you're their nurse and you can open their patient's chart, you can look and find like when the patient was admitted, what the patient came in with, things like that. Because you don't want to be that nurse that doesn't know anything about the patient. Just because you took care of them for 12 hours doesn't mean you know them, So what I would always do, once I gave report, I would ask important questions, and if they didn't know, I would make a note like, look that up, or things like that, so that way when I give report, I don't look silly, or I don't look stupid, or like I didn't look it up. So, for instance, if a patient had a head ultrasound, I want to know the result on that. So I'm going to go back, look at the results, and see what the radiologist's impression of it was. And then that way when I give report, hey, this patient had a head ultrasound 2 weeks ago, it said blah, 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 blah. Not like, oh, the patient had a head ultrasound 2 weeks ago. That's it. I don't know what it said. Because if a patient had, like a neonate had a grade 3 hemorrhage, it's important to know that, so that the new nurse can know that he has some sort of head condition. Probably head circumferences need to be done daily, things like that. Pertinent information. So always investigate your patients. It's not like you're becoming a PI or anything like that. You just need to know what's going on. You know, what's the background of the patient, why the patient's still here, how long is the, like, you know, if it's something like a diagnosis that's lengthy, you know, chronic, you know, that way they can understand that the discharge is going to be a bit later on. But if it's a patient, let's say, that's in and out, like a med-surg patient, you know, with just the procedure and then out the door the next day, things like that, like, you can tell them this patient has a history of blah, 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 came in for pain, had surgery, blah, 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 will be discharged tomorrow. Something like that. But once you kind of get a feel of how your unit does report and how you can receive report, it becomes second nature, and you ask the important questions without even knowing, and it becomes like, you know, a conversation with the new nurse, instead of like, oh my god, I don't know what I have to say, I don't even know, you know, this report's gonna suck. That happens. At first, it happens, believe me. But that, I felt, was, in the poll that I took in my unit, was a major anxiety producer in the unit. Another anxiety inducing thing was skills. You know, some nurses feel like they don't have the skills yet, which it's true. You don't. Like, they can't expect you to graduate and be an expert at doing IVs. You're just not going to get that. But like, you know, you just, with practice. What I did, because I was always like, I want to get in it, I want to get on it. I would be like, if a patient needed to get a Foley put in, or a straight cath done, or an IV done, I would be the first one to be like, can I do it? Can I do it? And without a doubt, people would say, yeah, better for me, of course. So that way, you know, you get the practice, and it does help the other nurse, you know. And usually if they were going to do it, they can lend you a hand. It's a win-win. But that's what I can say in terms of skills. You can't be expected to know everything, but try your best to get in on everything so you can practice more and be skilled in a short period of time. That way also you feel more confident in who you are as a nurse. It helps. An anxiety inducer for me, for instance, when I started my job at a per diem, I wasn't too familiar with where things were or how the unit was run. You know, there's, in every hospital, in every institution, they have policies and procedures for everything that they do. So it's about getting yourself familiar with it so that you don't do something wrong. And I was always so fearful about doing something wrong or not like following the protocol the way that they do it in that hospital, that I would get really stressed out. And another part was that I didn't know where anything was, you know, like if they had an Omnicell or a Pyxis or things like that, or the way that they take the meds out, it's a little different in every institution. So you just really have to practice and get used to how they run their unit so that you don't look like a fish out of water every time you come on. If you're a float nurse, that's something that you have to really, really deal with on a daily basis. You're going to be put in places that you don't know all the time. You may get lucky and stay there for a good amount of time if they need you and the unit is short. And you know the stuff, so they, of course, they're going to take you. They're going to, yeah, that float nurse that comes all the time. But if you're if you constantly float to different units, although interesting, I gotta say float nurses probably have it well, you know, in terms of skills, because they're exposed to different things all the time. For me, I think I would just be so stressed out because I just don't know where anything is in the Omnicell. I'd be like, hey, I can't find the chucks. Can you point it out? You know, I hate doing that, but it is a good thing to ask. So don't be fearful to ask, because I'm sure that people get lost in their own unit. But point being is that you need to get familiar with where you're at so that it could calm you down a little bit. If you feel like, okay, I'm comfortable with where things are, I know how things are run, you kind of just start to ease down a little bit. If ever you feel that there's a skill that needs to be performed on a patient that you've never done, do not be hesitant to ask for help. You have to know your limitations. Grad. If you don't know how to do a certain procedure, you can always look it up in Mosby's, because there are some times where there's procedures that you have to do that it's rare to happen in the unit. So even other nurses may not have done it before either. I had an instance where I had to perform an exchange transfusion on a baby, and it was a rare occurrence. You know, the only person that had seen it was this old fossil, this ancient relic that was still working in the unit, and she was able to get me through it. But if ever there is something that you don't know how to do, you need to ask your higher ups. I asked my managers to get involved, and they brought me, you know, the skill set. You know, there's like a little, in every hospital they have like their own, like some people use Mosby's, some people use other skills, manuals, whatever. And they brought me the skills manual for that certain procedure, and we all were hands on deck doing it. So it's like, just don't do something blind, because you'll end up hurting the patient. And even though you think that you look like a badass because you could do whatever, it just looks bad on your part. So just don't go above your head if you don't know something. Always ask and know your limitations. That's about it for this video, guys. I hope it helps. If there's anything that causes anxiety for you and you want me to mention it, or you want me to go through it, you comment down below. I can comment back and give you some tips on how to get better at certain things, whatever is causing you anxiety. I'm here for you. And that's it for this video, guys. I'll catch you in my next one. Bye.